On today's episode of IHAW Podcast, we are going to be welcoming our very own Hailey Ishmael. Hailey, welcome to our program.
Thank you for having me.
So today we're going to be talking about your journey that you had in hip and back pain.
Mm-hmm.
And let's start the journey by discussing the timeline that you experienced with your healthcare and your wellness journey. So how old were you when you first noticed something was off?
I was about 7 or 8 years old.
Okay, that's pretty early. And about what time or what age were you when you actually sought medical attention?
So I was about 15. It was my freshman year in high school.
Okay. And so you're 15 years old. What type of symptoms are we talking about that made you go see that doctor?
So I was having a lot of hip joint pain, back pain, and also sciatica down both my legs.
Sounds like a lot to be going on for a 15-year-old.
Yeah.
How did having all of that affect you mentally, physically?
Mentally, it was something I kind of had just accepted because autoimmune disease does run in my family. So I just kind of figured that's probably what it was. And physically, I would say it was definitely hard. I couldn't stand for more than 30 minutes. Had to have inserts in all my shoes. I couldn't wear heels. It was hard to work out at the gym. But most of all, driving was really a challenge.
So that's quite a few differences that you noticed early on from your peers. How did it make you feel to have impaired movements at such an early age?
It was definitely hard on my self-esteem, not being able to do everything that everyone else was doing. So that was hard.
Okay. It's a kind of a heavy ordeal for a teenager. So here you are, you're 15, you're a teenager, you're going to go see your pediatrician. What medical advice were you given?
So I started off at my family practice doctor. She ended up prescribing me low-dose muscle relaxers, but they didn't really help. So then I went back and she ended up running some blood work that came back inconclusive. So then she sent me to Texas Children's, and I saw a doctor there who then prescribed me naproxen.
Okay. So naproxen is an anti-inflammatory, and it can have some wonderful short-term benefits. They're known to have also long-term side effects. So you got the naproxen after a muscle relaxant. How did that do for you?
Not good. It was really hard on my stomach. It almost felt like it was eating a hole in my stomach, and I ended up losing 10 pounds. It was hard to eat anything.
That's not good. So you went back, obviously, to the doctor, and what was the conversation then?
She advised me to keep taking them.
With the weight loss?
Yes.
Okay. And what do you do? Because you have some significant side effects.
I refused.
Okay.
So then I ended up going to see a rheumatologist. And she was very well known and recommended to me by a few people. And in my first appointment, she ended up telling me that I was going to need a double hip replacement by the time I was 30, or I would be in a wheelchair.
On the first appointment, so that's kind of a very heavy appointment.
Yes.
Yeah.
But there was one thing that I uncovered that I kind of just mentioned it because it wasn't really that much of an issue, but I was just having some urinary urgency. And as soon as I mentioned that to her, that's when she went with the whole wheelchair by the time you're 30.
Oh, okay. So she must have been thinking, all right, so they had that kind of heavy conversation, scared you, thinking your life's going to be over as you know it.
Yeah.
What was the next move they did? It sent you to what test or what therapy?
They ended up sending me to physical therapy, and I did that, and it ended up helping with that issue, but it never gave me any relief for the hip and back pain.
And generally, when we hear about any type of urinary symptoms, we get aggressive with imaging. Do you have any?
Yes, I did have an MRI with contrast, but it came back normal.
Okay, so that's helpful.
Yes.
Okay, so the urinary issues, they got better. You did the physical therapy. Is everything cured now, or what was next?
So then I ended up going back to my doctor at Texas Children, and she wasn't really sure what to do, so then she diagnosed me with AMPS disease.
Okay.
Or AMPS syndrome.
And can you tell the audience what AMPS syndrome is?
It's amplified musculoskeletal pain syndrome, and it's basically a lesser form of fibromyalgia, and it's just you can feel pain anywhere in your body with no cause.
So that was the first time you had a diagnosis from your pediatrician. How did that make you feel to hear AMPS?
Well, I had not a good grasp on what that was when I left the appointment. I was kind of confused. So then after researching it further, I realized, like, I don't think I have that. Because I have localized pain and fibromyalgia is everywhere. So
you disagreed with what your feeling was. That doesn't make sense.
yes.
Okay. So you're like, what, 17 at this point? Where did that leave you then? So the doctor's giving you this diagnosis, you feeling that it's maybe not capturing what you feel you have. What's the next move?
I just kind of, at that point, gave up on the system. I just couldn't, nobody knew what was wrong with me, so I just figured that the right person would find me, or I would find them, or, somebody had to know what was wrong with me. It was going to take a while to find them.
So giving up on the system meant eventually it'll fix itself, but it's not happening.
Yeah.
Okay. You're 17, all right. So that kind of stops your traditional journey.
Mm-hmm.
You gave up. What's the next play? The next move?
Well, when I started working for you.
And you're about how old do you think when that happened?
I would say 18.
18. And if you recall, what was it that got the discussion to even come up? You come to work for us. You had
So since I was babysitting, so using the Tula was really difficult for me, and I think that's how the conversation got brought up.
Okay, and just for the audience that doesn't know, Tula is like a little cloth kangaroo pouch you put a baby in here, and my firstborn really loved it for sleep and soothing, so that's how we would go to sleep. So part of the thing was you put the baby to sleep in the afternoon.
Yeah.
And I think you had said that it hurts, and I thought that was a little bit strange that a small little baby was causing a young lady to have pain. Okay. So we talked about, let's back up for a second. So you're 18 years old, you're trying to do a job, your back pain's getting in the way of the job. How did that make you feel?
It was definitely frustrating, just another case of me not being able to do something that everybody else my age would be able to do, or should be able to do.
When we started working together, what did you first notice that was different about our approach?
So I was actually seeing results, and that made me feel really frustrated because the whole gait issue was something that we were so close to, figuring it out, because my dad would always mention that to me, and the doctor at Texas Children looked at me and said my gait was fine. So that was frustrating, but also hopeful because I had found somebody that could help me and actually wanted to help me. So it's like we were in it together to figure out what my issue was and how to fix it. And then it was just very eye-opening because I didn't even realize functional medicine was a thing. So then learning more about it and realizing it looks at all the body systems and everything as a whole versus one thing separately at a time, I feel like it's just different. It's a lot different, and you get better results that way.
So especially after doing standard of care and didn't help your issue, it's a little bit of out-of-the-box thinking, but you're kind of also looking for what's missing. What stone wasn't uncovered. So we did you mentioned gait assessment for the audience as just studying how you move and how you move in your frame. So we found a lot of micro corrections, I think you recall, with some targeted stretching. And how did the focus stretching that prescriptive stretching almost, how did that affect you? Or what did you recall about that?
It changed everything for me because at that point, my pain started going away. All I had to do was just stretch and engage my core. For me, stretching was just something you do that's gonna take you extra time at the gym. I felt like I could just get an extra set in. Why would I stretch when I could just get an extra set? But now I realize that was wrong.
Okay, good. So we started, I think, emphasizing a lot of the walking exercises. Mm-hmm. What's kind of the big messages that you remember take home from those corrective walking exercises?
Just that I need to be stretching daily and engaging my core and not offloading my body weight to my back when it should be like my glutes and my legs. And
Okay, good. A lot of
my
muscle
core.
kind of re-education. Good. You think started working on this for about what? How many months you think?
I'd say like 6 months.
And in that time period, what do you feeling the same, better, worse?
A lot better. By that time, I probably only had like 10% pain left, and that was on the days where I knew I was not engaging my core and I didn't stretch. So
now you feel pretty much 90% pain is gone.
yes.
Are you able to do normal life activities? Anything limitations?
No limitations.
Very good, very good. That's an excellent story. I thought it was very fascinating. I'm glad you were able to share that with us. An example of what it could be like when you are pigeonholed in a system that only gives you certain answers, and having sometimes a zoomed out approach can help tie things together and that might be otherwise wouldn't have discovered. So a simple, tiny corrections, a little bit of stretching, a little bit of movement, someone to notice, hey, you're not moving right, completely change your hip and back pain.
Yes.
Very good, very good. So thank you very much, Hailey, for sharing your experience with us, and thank you for watching IHAW Podcast.